So, you wake up in the morning with a scratchy throat or a fever. You may be wondering, is it allergies? Is it COVID, strep? Which one is it? Dr. Christopher Uhl is an infectious disease expert with Atrium Health Wake Forest Baptist. He says as COVID cases declined since a peak in January, other illnesses are now on the rise.
We're seeing some strep throat going around. There's a lot of common colds still going around that are due to several different viruses. But by and large, I would say that we're leaving our respiratory viral season and unfortunately entering our allergy season.
Dr. Uhl says COVID symptoms often involve a stuffy nose and sore throat, which transitions into a cough, while strep is usually just a sore throat. Allergies typically involve eye irritation at the same time as a scratchy throat, while the flu tends to be a fever with head and body aches.
So unfortunately, there's a lot of overlap between these. And so we have to oftentimes test to know for sure.
As far as the common cold goes, Dr. Uhl says there is not a test for that.
If you don't have COVID, you don't have the flu, and it doesn't look like you have strep, you got a cold. And it's going to run its course. And chicken soup and rest and lots of fluids are still the best thing you can do.
Lastly, Dr. Uhl says most of the milder respiratory illnesses don't require a trip to the emergency department. He recommends going to your primary care physician or an urgent care clinic. And if you think you're sick, be a good citizen. Stay home from work and stay home from school. That's a big one. If you're sick, do not come into the job because you're going to get a lot of other people sick as well.
Yeah.
One thing I want to point out that Dr. Uhl was saying when it comes to COVID, you know, we've had a lot of people get vaccinated. There's been a lot of people who've already been infected with the virus. So a lot of the cases that we're seeing now are a lot more mild. So the symptoms are going to be mild as well, which could have that confusion. Is it just a common cold or is it COVID?
Yeah.
So if you think that you might have something, just get tested. We have a lot of those take-home tests as well.
All right. I'm just glad that we're getting to a point in the weather where we are spending more time outside, and
Sure.
you know, because obviously in the winter this is when things tend to spread more.
Yeah, I always like hearing from him and his perspective. You know, he
Yeah.
was with us right through the thick of things back in peak COVID and everything, and he always just keeps it calm,
Very
and
calm.
easy to understand, it not hyper, and he's just going to tell you his honest opinion. So we appreciate that.
I love that about his personality.
Yes.
Even when it came to the cold, he's like, look, it's cold. There's no test for it.
Right.
Drink chicken noodle soup.
I
Get
mean,
some sleep.
But that's
That's
true.
all you
Everyone
gotta
knows
do,
what to do
folks.
when there's a cold. Like
Yes.
whatever works for you, you've done it before. Just do it again.
It is incredible though that he has the same voice and just way to deliver today as he did in the height of the pandemic.
That's true.
He's truly a hero.
People appreciate calm
Yeah,
communication.
Yeah.
absolutely.
Yes.